Good evening and welcome. I'm Matt Jacobs, Director of the Bob Graham Center for Public Service at the University of Florida. It's my pleasure to welcome you to the second symposium of our Sustainability into Practice series, which tonight will focus on climate change, health, and equity. And we had a wonderful first event in this about a month ago, and I'm sure tonight will be just as pleasant and intellectually stimulating as was the first one. Let me begin by recognizing our partners in organizing this project: the UF Office of Sustainability, the Florida Climate Institute, and the UF Thomson Earth Systems Institute. I'm an historian by training, so I'd like to take us back to April 4th, 1967. On that day, Martin Luther King Jr. delivered an address at Riverside Church in New York City. His speech that day focused on the US presence in Vietnam, but in it, he used a phrase that I believe is appropriate for tonight's event: the fierce urgency of now. When we think about the ways in which climate change, health, and equity intersect, the last year has imprinted on our mind the fierce urgency of now. We have seen how increasingly numerous and powerful hurricanes and other symptoms of climate change, a global pandemic that has killed more than 500,000 Americans and 2.5 million people worldwide, and the challenges posed by and opposition to enduring inequities intersect to create a fierce urgency of now. Of course, over this last year, we have also seen many labels applied to these intersecting issues of climate change, health, and equity. If we wish to act with intention, though, then we cannot let labels drive our lexicon. We cannot let labels derail our conversations and shift our focus away from the fierce urgency of now. Our path forward depends on conversations like the one we are having this evening. Conversations that are grounded, that do not increase our anxiety to the point of paralysis, and that do not ease our fears to a state of contentedness. Conversations that keep us connected to the fierce urgency of now. The Bob Graham Center for Public Service brings us together for opportunities like this, to have forward-facing conversations, and then to participate in internships, fellowships, and other forms of community engagement that spread civic awareness of the fierce urgency of now into communities. I hope you enjoyed tonight's conversation and that it helps you in your own conversations as you bring the fierce urgency of now to the issues that define your community. It is now my honor to introduce Hannah Ulloa, Communications Coordinator of the Office of Sustainability here at UF, who will take things over from here and who will lay out how the evening will progress. Hannah?
Thank you so much, Dr. Jacobs. That was an excellent introduction to tonight's conversation. Thank you to the Bob Graham Center for being such amazing partners in this. And I also want to recognize the Florida Climate Institute and the UF Institute, Earth Systems Institute for their help in supporting this program as well. The Office of Sustainability is really honored and excited to help facilitate this program. I can't do a better job than Dr. Jacobs in summarizing why these conversations are so important. So I just want to go ahead and introduce our amazing panel for tonight and let the conversation take off from here. Our moderator for tonight is Dr. Sarah McCune. She is currently an assistant professor with the UF Department of Environmental and Global Health, as well as the Center for African Studies. Her research looks at these complex dynamic intersections of health and larger systems and of things that are affecting it, such as climate change. And while her work mostly focuses in sub-Saharan Africa, it has led to a larger understanding of HIV/AIDS, maternal health outcomes, Ebola, and even COVID-19. So she's definitely an amazing expert to have guiding the conversation tonight. And with that, I will pass it off to Dr. McCune. Oh, actually, before I pass it off, I just want to mention we are going to be using the Q&A feature tonight for audience Q&A towards the end of this event. Please use that feature if you have questions for the panelists. Any other logistics questions, you can use the chat. The Q&A will also have upvoting, so if you have a question or you like someone's question, please feel free to vote in there as well. And with that, I'll pass it off to Dr. McCune. Thank you.
Thanks so much, Hannah. Good evening. My name is Sarah McCune, and it's my pleasure to be here with you along with these three excellent panelists. I'm going to go ahead and ask Drs. Holder, Ryan, and Liang to go ahead and turn your cameras on as we prepare to open this panel discussion up. I want to start by saying many of the same things that Dr. Jacobs said, and that is that 2020 has laid bare for all of us the significant role of climate change, health, and equity independently, but more importantly, the intersection of these critical societal components. COVID-19 as an emerging zoonotic disease is part of a class of diseases largely linked to changes in land use and anthropogenic pressure on complex ecosystems globally. The origins of COVID-19 aren't the subject of tonight, but we have to think about these complex dynamics of climate change and how they ultimately affect human health. Some of the pathways are more direct, others are secondary, tertiary. Simultaneously, we've got social movements in the US and globally. Here, we think about the Black Lives Matter movement and other movements for social justice. There's a synchronicity to it, but there's also an opportunity when we think about the inequities that have been laid bare by this, but they were always there. The inequities that are built into the structures and systems of American society. And finally, let's think directly about climate change. This year, we've had an extremely active hurricane season, and now extreme weather events are threatening the United States, perhaps not here locally in Florida, but we're sympathetic to what's happening to our fellow countrymen. So 2020 has laid bare these essential elements, and public health is, for me, where all of these things come together. How do we look at this as a system? It is neither just health nor equity, neither climate change, just climate change, or health. It's a complex morass that we have to begin unpacking. And so tonight, I challenge you to think about public health as both the local, very local, in your home, in your yard, in your town, certainly in our state, but also global, because the lines between global health and local health, between global climate change and local climate change, those lines are blurred anymore, quite porous. So it's my real pleasure to welcome Dr. Cheryl Holder, Dr. Sadie Ryan, and Dr. Song Liang to the panel with me to have this discussion tonight. I want to start out, and what I'll ask you each to do is answer this preliminary question, but take a moment first to just introduce yourself, your name, what your position is at what institution, and then take a stab at this first question. And then from there, we'll go to a more fluid system. But to start, I would like actually to give the first question to Dr. Holder and ask this. So through the lens of equity, I'm going to challenge you to do that a bit tonight. So thinking through the lens of equity, what is your approach to understanding climate impact on health outcomes? Dr. Holder.
Good evening, everyone, and thank you for inviting me to be part of this great panel. And with University of Florida, I'm at Florida International University, Herbert Wertheim College of Medicine. My title now is Interim Dean, Associate Dean of Diversity, Equity, Inclusivity, and Community Initiatives. But I primarily see myself as a general internist, a general practitioner for 30 plus years in the Miami area and an HIV treater. And with that, when I think of equity, I think of my patients. And I think of the hundreds of years of difficulties that they've lived under because of policies. And I tell you one story during the COVID time, a patient calls me up and he was in distress. He lived in a house with an elderly grandparent and a sister who had mental illness and his family, and that was a 1-bedroom. The mentally ill sister was in and out of the house. He didn't want to Baker Act her because he was afraid that she would go into a situation where we know being in a difficult hospital with mentally ill and there were coronavirus. And he was panicking. What do I do? Now, through no fault of anyone's, this is what happens when our people who are more vulnerable, they have to work, they don't have shelter that is equal to be able to stand 6 feet away. They have multiple medical conditions to cope with. And then how do they do it? And then finally we said, I understand you can't institutionalize your sister now, so everybody got to wear a mask in the house. But that tells us how do we respond to that? I mean, this didn't happen overnight. And what COVID did was accelerate and amplify all the inequities that we have seen for the last hundreds of years. And we know much of this started in 1619 when a society decided to choose a group of people that would be subjugated and would not have equal access to money, equal access to proper housing, equal access to healthcare, equal access to a life and to be fair, to live a life that is full, which is what we now are fighting for.
Excellent. Thank you so much for that great introduction. Dr. Ryan, can I ask you that same question? It's through the lens of equity. What's your approach to understanding climate impacts on health?
So I'm Sadie Ryan. I'm in the Department of Geography and jointly appointed to the Emerging Pathogens Institute, and I'm a medical geographer. So I'm very interested in how these situations of health propagate in space and what they look like on landscapes. And in particular, my focus is on looking at climate impacts on vector-borne diseases. And so taking a much sort of larger scale view of this question of the lens on equity with sort of the approach of being able to link thinking about where is it most suitable for these vector-borne diseases to persist, exist, be introduced even under the context of climate constraints. As we think about climate change, who is exposed to that starts to be different on the landscape. But even in the now, who is exposed to that really amplifies that lens of vulnerability that we see with all the issues of equity already existing. Things like housing condition that may mean that some people are simply more likely to live near abandoned or neglected properties, simply in places that are more conducive to mosquito breeding, who maybe can't afford to do vector intervention for themselves. And so I take this larger sort of view of where climate is going to be shifting around the landscape and putting more people at risk for longer, perhaps, or differently. So I look forward to the rest of this discussion tonight, thinking at these multiple scales.
Excellent. Thanks so much, Dr. Ryan. And Dr. Liang, same question.
Thank you. Good evening, everyone. And my name is Sean Liang, and a faculty member with the Department of Environmental Global Health, and also affiliated with the Emerging Pathogens Institute here at the University of Florida. So my area of work, I want to kind of start introducing kind of something I've been doing over the past 15 years. So my primary work focused on the risk assessment of health issues associated with water sanitation and the food parasitic disease belonging to our category of disease called the neck tropical diseases. And for those who haven't heard about the term before, and they refer to a group of disease, including parasitic and viral bacterial disease that cause substantial illness for more than 1 billion people globally, typically affecting the poorest of the poor living in the impoverished environment of the tropical and the subtropical region. So that's the way I actually, from kind of, the addressing the equity, from the study perspective, that's where I actually kind of already started addressing, trying to understand how those poorest of the poor are contracted to the diseases, what kind of environmental, social environmental factors make them vulnerable. So the climate impact on those health outcome, and since a lot of those kind of disease pathogen I've been working on has a very close tie to the environmental factors, like the temperature, precipitation, agricultural practice. So my work, I would say climate impact on those health outcomes seem quite naturally into the area of my work.
Yeah, excellent. Yeah, and I'm happy to hear you mention neglected tropical diseases, because we don't talk about them as much in a domestic context as perhaps we ought to. So let me probe a little bit more with you, Dr. Liang, now, and say, when in your experience globally, and then thinking actually about applying it locally, how is climate affecting? I understand the space in which you're looking at it, but how does climate affect those neglected tropical diseases that you work with?
Thank you. This is a very good question. Again, I probably want to kind of start from the study we've been doing in the 3 countries, China, Cameroon, Ethiopia. So we're looking at how in those 3 countries, we're looking at choose a group of the disease, one of those diseases called the schistosomiasis and the cholera, and in particular, and also soil transmitted helminths. So lots of those, those disease and also disease causing pathogen, there are again, as I mentioned, that the closely related to the environment, water, sanitation, hygiene practice. And those, again, those are also very closely related to very sensitive to kind of environmental factors as well.
Mhm.
And so in those three countries, we look at the specific, in the Cameroon, for example, we look at how flooding and extreme weather event in far north region of the Cameroon, which is in the Lake Chad Basin, how those kind of extreme weather event, those the flooding impact the transmission of the disease in the region. So that's one way we address those kind of issue there. And in Ethiopia, where it's kind of different, is in looking at the from now to next 30, 40 years. Given those climate change, business as usual scenario, what we expect 20 years, 30 years from now, and the disease endemic situation in that country. We also use work with the climate scientists and trying to understand how those factors impact the scope of kind of the endemic area in those countries.
Yeah, excellent. So what I hear you saying is a lot of it has to do with the habitat for these pathogens changing, whether it's because of flood or temperature changes or whatnot. So that probably means then that you work closely with forecasting and modelers that project out what those changes may be.
Yeah, well, we work with kind of like the different aspect in our project in the Ethiopia. We actually kind of develop a model, but in Cameroon, instead, we actually kind of collect the field data, trying to understand how the new cool kind of outbreak schistosomiyces, including both schistosomiyces and the cholera, are triggered by those extreme weather events, or how those extreme weather events sort of modulate the outbreak or transmission of the pathogen environment. So that's kind of two different type of studies.
Yeah, Dr. Holder, can I ask you to elaborate on that same idea? So this idea that climate is directly affecting health, and maybe a little bit thinking about in practice as well. So you're, as a practitioner, as a clinician, you're positioned to answer that in a way that's different from our other panelists.
I don't know if I said it correctly, but I think that's really exciting work because we're experiencing issues with the climate now. As we know, the mosquito, especially the Aedes aegypti, which bites day and night and lives indoors, and really with the changes that we're seeing in South Florida and the temperature changes across, its habitat is moving further up and its breeding season is longer, is shorter, it replicates faster, and Dr. John can explain it even better with the malaria, with the different infections that the mosquito carries. So we see Zika, we see dengue, or even now with West Nile. And so there are lots of things that are happening right now. Now, how do I see it? Because when my patients come in, they're not going to know about the changes in this whole ecosystem. They just present to me like my patient did with her Zika infection, and she had a baby. Unfortunately, the baby was fine, but she developed postpartum depression. Or many of my other population and my friends who are pediatricians are beginning to see Florida's water table is low. And as the sea level is rising, it is pushing the septic tanks, and there are over 100,000 septic tanks, and our sewer system has not been upgraded. So we're seeing now backflow of nutrient-rich waters. So even during our King Tide event, which is when during the tide, the water comes back up, this is nutrient-rich. So we're seeing right now, not 20, 30 years, the effects that the children with skin rashes, we're seeing more Zika, we're seeing more dengue and West Nile. So unfortunately, it's not too far in the distance, and many poor people, again, because of the living conditions, we don't even have a screen ordinance in Dade County or Broward County. So my patients who live in rental apartments, they can't even have screens to say they could keep out the mosquitoes, because there's no mandate for screens. So these things are, well, I wish we could get some of that research right now, so we could even map where these are happening, where there's screens, what's going on with our population, what are the skin rashes we're seeing, how much dengue, West Nile, and so we can really impact the communities right now, because it's happening now. It's not in the future.
Yeah, that's a great segue. Dr. Ryan, you want to chime in?
Yeah, I was just going to say, Dr. Holder, I can hand you some maps I made last week to capture the sort of thermal responses in Florida for a bunch of these diseases. And this is, this is sort of kind of an odd role for me to play because I'm trained as an ecologist and an ecological modeler. And so we've sort of taken these very, mechanistic models of what the mosquito does and what the pathogen does. And then we can think about it as this sort of thermal response on the landscape. And then we couple it to climate models. And I was not trained as a climate modeler. And so it means, you sort of have to, you simply have to have an interdisciplinary look at all of this. But it's at the same, on one hand, yes, it's really useful that we can put these things on maps and show people, hey, this is urgent. But I think the big challenge is thinking about what those responses are. Because, yes, a map tells you where. The question is now what, right? And so a lot of the struggles I have with this is that we can talk about the sort of the climate health relationships and talk about forecasting it and say, what is a useful tool, right? So do you make your decisions for something that's going to happen 3 months in the future? What are the kinds of decisions you can even make, right? Like, can you deploy more vector control? Can you not deploy more vector control? Can you put together a screen ordinance? Can you create grants for people to have air conditioning and better windows? And so I think there's sort of lots of interesting conversations to have at kind of the level of implementation. And in the work I've done, you sort of get to the point where you're about to implement and then a huge flood shows up, right? And then it's like, oh, what happens post flood? Well, there's lots of water sitting on the landscape. There's lots of cleanup to do. This happens in Florida with big storms as well, that you suddenly have, sort of your mission has to switch over to cleanup rather than prevention. And so I think there's sort of lots of these entangled issues at different scales. But I'm happy to give you a map or 2 or 3 anytime, because I really believe that these sort of point of care experiences tell us a lot more about what we need to be doing when we're meeting the models with decision making.
That's very, very useful, because as a clinician, if I knew the areas, we can alert those clinicians in that area to educate the patients. And so when they present, let's say my patient who's premature labor, we know that heat has direct relationship. If we can educate our OBGYNs that these are the areas, these are the hot spots, how do you prepare your patients who live in the hot spots so they can be properly hydrated, that they don't take buses, that the families find a way, if they have no transportation, you support their Uber. And so there are lots, or you do telemedicine for some populations, much more so than you would other populations based on it. So there are many ways that we could, if we can get this data that's looking at the populations now that are most vulnerable. And we know them already. I mean, coronavirus has pointed it out, diabetes pointed it out, obesity epidemic pointed it out, hypertension has pointed it out. I can go through the data endless in Florida, and I can tell you who has what and what does it all mean. So now we need better on-the-ground data to say, this is what next. How do we get the physicians to show us and code properly? And then we can get dollars to protect our population. So this is exciting.
This is great.
And one thing I
Absolutely.
also want to mention is kind of related to Dr. Ryan just mentioned that the neck tropical disease, we've been seeing elsewhere is also existing in this country as well. Don't forget. And in the southern United States, Appalachia, we actually have those quite a few neck tropical disease, not to mention dengue is currently in Florida, but also some soil tract helminths. We just don't know to what extent. We know in some historical survey, we know that the human prevalence infection in certain rural communities is very high. But what's the trend? Current trend, future trend is there's no public health surveillance about those kind of disease. So those are the potential, I think, make those vulnerable population really are at the risk of infection, given that the pathogen are also very sensitive to the climate.
Right. And
Excellent.
sorry.
Yeah, go ahead, Sadie.
Dr. Holder mentioned earlier, this sort of, you see maps of Florida and you see this sort of climate line moving up the state with sort of more months of hotter temperatures, more months of just higher average temperatures even. And so we're really sort of seeing Florida as this microcosm of sort of a tropical landscape that is, that sort of tropical season is extending. And so we're going to see, better establishment of tropical diseases being possible. And I would love to know how to get feedback to point of care clinicians to know sort of what their scope of training is, even to anticipate some of the diseases that Dr. Liang was describing.
Yeah, I think it's an excellent point that Florida is very well positioned to inform globally vulnerable populations. And I think we should take that on, that we are ecologically positioned more comparably than any other place in the country to serve vulnerable global populations because we are in the tropics and subtropics. The conversation thus far is really focused on infectious diseases, which I think is excellent. And I love the idea that one of the things that might come out of this conversation is connections between some of the skills and the tools of Dr. Ryan's lab and the work with geography here to the needs of clinicians statewide. I think that's a fantastic idea, and I'm taking notes, so we'll make sure these all go some to the people that can make things happen. But I want to go back to that question because it's not simply infectious diseases, right? So in the spirit of sort of storytelling, Dr. Ryan, can you share with us from your experience? I know you work in the field, you're on the ground as much as you are looking, aerially at maps and spatially, but how do you see climate impacting health on the ground?
Well, so, I mean, as I mentioned, sort of in passing, I guess that I've done a lot of work in Ecuador previously, and we have, sort of really nice fine scale data at the household level. So we can really sort of investigate the social ecological system in place in a city that is endemic for dengue. And it's actually hyper endemic for dengue, which is a term we haven't yet got here, thank goodness. But so basically, we've been able to sort of think about teasing apart these mechanisms of things like, is it that doing entomological surveillance is your best bet for figuring out what the risk is at a sub-city level? Is it that you always need to have case data to know where the riskiest parts of town are? Are there different factors about sort of, your occupation and things like that interface? So sort of really capturing that social ecological context. And then, as I mentioned, suddenly a flood that you didn't have in your model and nobody was expecting can suddenly just divert all of the resources all at once. Your field team can't be out there because they're cleaning up floods. You've suddenly got water in places you didn't have water from precipitation, so people didn't anticipate that. And you've got a whole host of different disease risks showing up. We also did, a small study on what vibrios were in the estuarine system. And so all of a sudden you have to think about some cholera risk maybe. And it's these sort of intersecting vulnerabilities that happen with a sort of your normal climate lens followed by your extreme events lens that really sort of cause these complete disruptions and sort of diversions of what you thought might be happening. And so for me, that experience was really important to know about because it's all very well making these models and saying, here's your decision-making framework, when there's only enough resources to do one or two things, and suddenly everything might shift. And again, I sort of see that here in Florida as well, when we have these extreme events, it suddenly changes the context for what's going on in your sort of normal climate health relationships.
Yeah, we become first responders, triage, in the sense of we have to determine, can we do the sometimes research that's about prevention upstream, or do we have to move to response and reaction rather than proactive planning and research? It's a really good point, and it's an interesting metaphor for the entangled conversation of climate health and equity, right? Because where do you start? And I think as we, the panelists and I talked briefly last week, we felt strongly that we wanted to hold this lens of equity and have that be our point of entry into the conversation. So we're continually talking about health, the relationship between health and climate, but again, through a lens of equity, it's only revealing those inequities that are already there. So who are we responding to now in the crisis? Those people who are already vulnerable, right? Yeah. So Dr. Holder, or anybody else, I'm interested in opening it up beyond infectious disease, because I think there is there's a lot out there outside the infectious disease space. Do you want to chime in on that
Well,
or something else?
look yeah, I love the comments on equity because many times when we use the equity lens, we often hear about Black and Brown people and vulnerable populations. But the importance of the equity lens is that solutions that you find for the folks who are now impacted and most vulnerable also helps all of us.
Yes.
Because I often think about environmental justice is not new. For many, many years, at least 40, 50 years, I've been involved, not me personally, but I got involved in about the last 5, 10 years in environmental justice area. And then the last 4 or 5, bringing it together with climate change. But I often think when the fence line communities that we're getting, which are mainly Black and Brown, who are getting the brunt of all the pollution, of all the chemicals, of all the things that we're doing that is killing our planet. If we had taken an equity lens and we had looked at the issue, we could have used this as, I always call it, the canary in the coal mine. When people are speaking up, it would have saved all of us. Instead, we did a not in my backyard, which I tell folks, it shouldn't have been not in my backyard. It should have been not at all. We should have really challenged the concept of extraction and fossil fuel because of the damage it was doing, not just for the fence line and the Black and the Brown people, but to all of us. So when we look at equity, if we believe as humans that everyone should have a fair chance of living a full, healthy life, and health we mean, and the definition of health is not just your physical, but your mental, your physical, and your social well-being. And if we all as humans have that right, then it is appropriate that we look at the needs of the folks who are impacted now because it helps all of us. So absolutely, if we look at my patient who has COPD worsening because of all the pollution and then the heat, and with ill housing that is just not prepared, not sufficiently weatherized, so she loses all her heat, all her cooling with that one air conditioner, she loses it all, so her bill is skyrocketing. If we address her issues and look at the needs for energy efficiency, look at the needs for proper insulation, weatherization, and the proper approach for that vulnerable patient, think about it all over. As much as my patients, all their issues and preterm labor happens with heat, think of the middle income and the rich mother who sends that child out to play in that temperature and they come right back in. So as my patients who are screaming out and need the help, all the solutions that we find for this population will benefit all of us. So the equity lens is crucial for humanity, but it's also crucial for our planet's survival.
It's a fantastic reminder. Yeah, thank you for that. Song, would you like to comment?
Yeah, I also want to just kind of follow up Dr. Hooter's point here related to the kind of situation in Florida. A couple of years ago, Dr. Ryan and I myself, we actually involved our mini project and reviewing public health impact that climate sensitive hazard in Florida, and working in collaboration with our colleagues from the Florida Department of Health, we get a chance to review some of those kind of data, current data we have, looking at one of those specific kind of climate hazard, heat, for example, extreme heat. And you see there's a kind of like a strong correlation for ED visit versus the kind of the heat. Well, that's not surprising. I think that's something we would expect that's going to happen. But what's surprising is that if you look at the global picture, looking at the extreme heat and the versus like the mortality over the 65 years and older population, global trend is actually increasing. You see that increasing trend. But looking back the kind of data, and looking back to our population composition, increasing elderly population in state of Florida, we actually have a lot of knowledge gap here. So that's something I think it's also from that perspective, I think there's a pressing need to understand it, for enhance the public health surveillance. I would just say that's probably one of the things, probably Dr. Hooter, you see lots more patients in your practice, but from our side is that we just look at those kind of data are showing those trends, but we just don't have more information for our state.
Yeah, it's an excellent point you raised, which I would like to intersect in or interject into the conversation, which is intersectionality and thinking about vulnerability, not just by um, race, ethnicity, but age, by sex. There's lots of different dimensions to society, and we need to hold on to an intersectional lens when we think about vulnerability. And it changes based on your exposure. Are you talking about heat? Are you talking about I mean, I use COVID-19 as the example. Everyone was on pins and needles about children, and it turns out that's not who we needed to worry about with this one, right? And the next one, maybe. But yeah, really excellent point. And again, bringing it back to Florida. So the idea that we could use Florida as a fantastic sandbox to better understand some of these relationships than we are so far.
Yeah,
Ryan,
absolutely.
oh yeah,
Florida.
please.
No, I don't know if Dr. Ryan had something, but Florida is a perfect place to look at these issues because we do have we have some of the richest people in the world. I think when they look at the total billionaire population, we're pretty high.
Mhm,
We also have a pretty poor population, even in our cities, which are pretty poor, and very high housing cost and a old housing stock in very many places, and also manufactured homes. In Arizona, they did a study looking at where the heat, and they used the index of how many people applied for energy support, energy assistance. And in places that didn't apply for energy assistance, and they tracked it and saw the admission rate was pretty high and heat illness problems. And they tracked it to a manufactured housing community of a lot of older people in these manufactured homes. And so they weren't able to get the assistance to keep their AC going, and they ended up having worse outcomes. In Florida, they've tracked some of the heat. Port St. Lucie area has tremendous amount of heat illnesses, and also areas that were redlined. Again, policy that pushed people in communities that were not invested, that did not have trees, that have more pavement and more density. And those areas have worse outcomes. So we have so much information that we could really start doing some changes, but we do need the right policies and we need the right support.
That was my next question. And so I'm going to pitch this one over to Dr. Ryan. So, what role does policy play in all this?
Well, so I mean, when we talk about climate change, we start mentioning things like the representative concentration pathways, which spell out these different scenarios of when we choose to mitigate and how much, looking over these long time horizons, like 30 years and 50 years and 80 years into the future. And a lot of times that's not actually the scale at which decision makers even have their jobs. And so it's a really sort of interesting juxtaposition of, you know, sort of what kinds of decisions you can make in the face of mitigation questions, and whether it's, you know, what can the individual do versus what large scale changes need to occur. And I think that there's definitely a really nice nexus of efficiency that gives everyone good outcomes, where, you know, you can sort of be energy friendly and reduce cost at the same time without, you know, pumping more air conditioners into the climate, to put it bluntly. And for me, the sort of the question of where policy intersects with all of this that I do, is more thinking about, can we usefully translate our predictions under these different scenarios into being able to slot into planning. And so sort of, if you know that you're in a county where my model says that you're going to be more vulnerable to these mosquito-borne diseases for more months of the year in the future, maybe that's where you can start planning, you know, which part of your tax base you're going to allocate to the vector control board, or whether you're going to put in an education plan on that particular disease in terms of public health education, public health intervention, and informing physicians that these symptoms might be about this disease. And so there's sort of different parts at which policy intervenes or intersects with what I do in relation to health. One of which is obviously, you know, hoping we can do something about climate change in a way that is affordable, because that's really, you know, one of the constraints on it is the affordability of doing something. And then thinking about just using what we know about what's going to happen, no matter how well we do, to do some planning. And so I think that's that's my best placed answer for that for now. I'm sure I will start thinking as soon as the other panel members have things to say.
Yeah, excellent. Dr. Liang or Dr. Holder, you want to chime in on policy? If you had a magic wand and you could make policy tendrils come out the end of it, where would you aim it?
You want me to, I have lots of things. I must say that I do love that if first we'd have to have a respect of the science to be
Mhm.
able to accept the information that's given to our politicians and then use it. As we've seen with coronavirus, that unless you do respect it, no matter what you do with the data, it may not be used. So I hope we do find politicians that will, at that basic level, understand that. Because when I think before Zika really hit us, we had reduced our mosquito control in Dade County down to 5 people. And of course, we were a setup for all these vector-borne illnesses. It's now up to 60, and they're actually doing some work to really prevent it. And we've seen the improvements already. So I think if we can have data that is used appropriately, that is the first step. And then education. So one of my big policies would be having education for every level of our community. There are too many people who are not realizing the impact that climate is having right now. Because it's not impacting the richer communities at the level where they're uncomfortable, because you can go from air-conditioned house or an air-conditioned car to an air-conditioned office and back again and never quite feel what it's like when we say heat index of 90 to 100, and you don't know what that's like. But my patient who works outside, and a lot of those street vendors out there, I work in populations where they're uninsured and they come see me. So they're feeling it, and I'm seeing the effects on the kidneys, or the farm workers who have not sufficient water breaks. So I think we are going to have to look at policies that take into account what heat is going to do in South Florida, what extreme weather is going to do in South Florida, and start addressing the needs of our population and not really stay heads in, what is it, head in the sand, whatever ostriches do. They always use those statements. But I see the governor just put in for a $1 billion bond issue. But a lot of it is not in the prevention side. A lot of it is going to improve our infrastructure resilience, which for some it's great and we all need it, but we need to be able to do things simultaneously. We don't have the time to wait for whatever they do with our infrastructure without the population being prepared. So the biggest policy would be to educate our communities on this, have our communities be citizen scientists. They need to start helping us collect that data and sounding the alarms faster. Because if we had a crew of people in our community who could feed Dr. Liang some of the changes that they're seeing in their skin or diarrheal illnesses or anything that happens to them timely, we could do it. And we have the technology. If I could get the term labor and the temperature in the indoor housing, I think we can really make a difference, but that takes some policy changes.
Excellent. So I really hear you targeting educational policies that support education of people on climate change. Dr. Liang, do you?
Gathering the
Sorry?
data.
Yes, and gathering the data, prioritizing the science. Dr. Liang.
Yeah, I couldn't agree more with both Dr. Hood or Dr. Ryan on their point here. Again, way back, when Dr. Ryan and I reviewed that the paper, the book chapter on the climate impact of the public health in Florida, one of the things through our review, and we actually identified quite a few sort of a knowledge gap, from our public health professional perspective. Sometimes I feel like it's we're in a kind of difficult situation. One is that there are lots of those climate science research work, and another is that we're trying to look at what's the health impact. But those health impact, the important, the science, the data, the evidence is what we need to inform the policy. But the issue is that sometimes the link those two, it's not easy. One is because of lack of data. The second is that we need some support. We need some, like the policymakers support. We need, so lots of those kind of things. I think, this is something, I think, I would say that the good science and the evidence is one of those kind of, I would say urgent need, what we're also facing as well, to get those information we need to kind of inform the policy. That's kind of, how I also, again, totally agree with both of our panelists.
Yeah, so in keeping with what I heard Dr. Holder saying about needing the data, but it's interesting, right? I mean, we started out, there was a comment early on about these interdisciplinary teams, and it's a mantra of my own. So I have my own bias, but it really, what I'm putting together from the conversation is, one is the bias in research to sort of asking more fundamental questions. And I think someone else had a near similar term, but my question to my public health students is always, so what? Right? If you read an article for a class of mine, the first thing I'm going to ask you is, so what? Why do we care that this research has been done? How do we move it down the line towards application? And policy is one space that we know data as we collect it can be applied, right? But I also heard language about citizen scientists, right? And connecting people on the ground to the science that we're doing, because that's then how you can form champions. You can find your champions, you can help give voice to the voiceless, but at the same time, lots of those voices are already there. So you can just be an amplifier and allow that to carry forward. That really leads into one of my questions for you all, and that is, what are the strategies that we have for making sure that the communities who are most affected by these issues are part of the discussion about the solutions? Because we all know that the people that are affected most by something have already thought through most of the potential solutions that you can come up with, right? So one is, how do we make sure that they're involved? What are the strategies? And then my personal question, you weren't warned about this one, is how do we go far enough upstream? This is the classic problem of public health. How do we get far enough upstream that we're really prioritizing the prevention of these things, rather than, in the old metaphor, of pulling bodies out of the river as they're coming down? How do we become proactive rather than reactive? Anybody have thoughts on those?
I have some thoughts as an academic, and also as someone who wants to make a difference. That those two things aren't always compatible, and that's a heady mix to sort of lay into this panel. But oftentimes the reward systems for doing the kinds of research science that do these sort of climate health linkages are not going to be the same as being able to impact the policy down the road. And that's a really hard one to navigate. It's hard to explain that to students. It's hard to think about it in my own research. And the fact that I go way outside my comfort zone in training and talk to decision makers and really want to sit down very early in the process and say, what are the decisions you can make? You're a practitioner on the ground. What decisions can you make? Not everybody can get into that space easily. And so I think sort of, if we can put that message better into the hands of people training to do this kind of stuff, that would be great. In like encouraging mechanisms for people to meet stakeholders and be comfortable in stakeholder space very early in their careers, if this is what they want to be doing, is important. And I'm not trying to plug Dr. McCune in our panel, but this is something she does very well. So kudos to you, and I hope other people have a bit more on this.
Yeah, what I've done in looking at it as a physician, when you think of the numbers out there and what physicians do, and I extend it to clinicians. So this is why we've joined the Florida Clinicians for Climate Action. And looking at clinicians, there are about 1 million doctors. There are probably about 5-6 million nurses. When you add all the clinicians out there, you're looking at millions. Each of us interact with thousands of patients, and we meet them at the point they're vulnerable, and they want to learn, and we are trusted messengers. So one of our strategies that I truly believe in as a way of educating it is helping the patients connect the dots, helping the clinicians connect the dots. That when they saw that angry young person who came in and they had a fight at home in the hot July they can also say, it's not really that you're an angry young man.
Mm.
Maybe it was just too hot in your house.
You're hot.
It's just hot. And we see this happening. And that clinician can then find ways to just get them out of the house, get some cooling, and that may decrease. So if we can do that and we can start educating our communities, because everything is local. And if our community is educated, there is power in community. Because if you look at what makes you sick, is your access. If you do not have access to money and power to generate those policies. If we have power in our communities by our clinicians being trusted messengers, educating our population on what's happening to them, they in turn will vote and we'll help them because they don't want their children to get sick. Every time my mom, the mother of an asthmatic child, that child loses how many days in school because they happen to live next to the highway, and that child now cannot get a good job and they're relegated to low income. That mother is ready to fight. And so we need to get the power of our community by our clinicians stepping up, educating our communities, and having the resources to say, we need help now, and we need you politicians to recognize this is the way forward, because it not just helps my community, it helps your community. Because what's happening to me now with climate change is just a matter of time before it's you. And so we can
Absolutely.
hold our community.
So I know we're about to switch to the Q&A. I see Hannah's prompting me. I would like, if it's okay, can I give our panelists just a second to give one takeaway message before we wrap up? Is that all
would be
right?
wonderful. I was just thinking, with all the discussion about involving citizens and citizen climates, this would be a great time to pivot.
Yeah.
to the audience.
Exactly. So if I can, what I'd like for each of you to do is just sort of in closing, and we'll do an open Q&A with the audience at this point, so we're not leaving yet. But if there were one takeaway message that you could leave the audience members with that was about how they could take action, what would that message be? And I'll
For me,
open it.
Educate
Any of
yourself.
you, educate yourself.
So many
Okay.
resources out there. And then when you educate yourself, think of who is happening now and what solutions you can help them, because that solution to help who's happening now will help you.
Excellent. Dr. Liang?
I would just say engagement, and through both individual or public, voicing concern, either as individual or a member of a community or even social movement, urging those with power to take policy actions.
Excellent. And Dr. Ryan?
I would build on top of both educate yourself and engage with your community to the point of being able to influence policy, that reach out and keep asking questions and ask questions outside of your normal space until you get the answers you're looking for, and then carry on educating yourself, carry on engaging, and just keep going.
Excellent. That's great point at which we're going to pivot now to the Q&A. There are a couple questions in here. So I'm just going to read through these, and if there's somebody, some of them I've already looked at a little bit for clarification or targeted, but otherwise chime in if I don't call on someone. So the first question from Grace is there a plan to modify the sewage systems in Florida? Does anybody have a educated response to that?
I know in South Florida, there's part of the $400 million, $500 million resiliency package. And now with some of the initiatives, there's looking at ways to improve it. Fort Lauderdale has had to take steps because there's been so much breakage. Now Miami-Dade is looking at areas. I'm not sure the rest of Florida.
Sadie or Song, do either of you know anything about it? No.
No, that's not
Okay.
something.
Okay.
But it has
Not our
to be-
area of
But
expertise.
now I want to know.
Yeah. Because of the population growth,
Yeah,
we're one of the fastest growing states.
Mhm.
And without proper infrastructure, we're not going to really sustain this population growth.
Yeah. The next question, Dr. Holder, is directed at you. So how do you connect the dots from your patients who need help to government subsidies and articulate the benefit to the entire MDC for diverting resources in this direction? Seems to me that the businesses and government community has no understanding or acceptance of the dots connections.
Yeah, it's difficult. And I work with populations. So what we're looking at when my patient comes in with our decompensated COPD and trying to get resources from Florida Power and Light to help pay our bills, um, we then try and connect her with different social services. It, we have developed a medical legal partnership with the Florida Clinicians for Climate Action for this very reason. What forms can we give? So if we identify problems in a house, what legal forms we could give the patient to then take to the different offices to help the process. And then we'll have a physician document this. So we are it's still infancy, developing that relationship with the lawyers and the doctors and educating. One of our big issues is if we can code, and coding is how you get paid in medicine, and we can also track the diagnoses. And if the health systems recognize that these changes are happening, you will start seeing, because we just have a study showing that during the extreme weather, intense rain, visits to the clinics, visits to the doctors are down. When your visits go down, that's less payment. So we're looking, if we're going to have more and more of these intense days, it's going to impact bottom line. So we know it's going to happen over time. We just have to accelerate it.
Well, and as a system scientist, if people are, I mean, you think about COVID did this as well, but if people are not going to normal primary care visits, they're going to show up in the ER, right? So they're putting off normal primary care. So the costs are not just those primary costs, lost income, but costs assumed by the system. There were a couple of comments made early on where you think this does go back to the healthcare system itself and us having to rethink about these things, because we put a lot on our physicians already, right? They are playing so many roles for the community, and yet they're having to see patients in 5-minute increments because in order to keep costs and doors open and pay staff, the volume has to be at a certain level. So can we actually expect physicians, primary care physicians, to have the time to interface with the community members to that degree? We're asking a lot of them, is my point, right?
Yeah, well, teamwork. And what we look at now, what's happening with climate is pushing us how we even deliver care and teamwork. So it may not be the clinician that's going to do this first step. It might be the nurse assistant who takes it. So it changes how you collect information on your visit. So on that form that the patient would fill out, we could change some of those questions and ask about heating in your house, ask about cooling in the house, ask about screens in the house. So you can collect this data. And our computerized systems now can support this. But what we're looking at also is that this may help push us to keep telehealth, especially in primary care, and keep the reimbursement at the proper level. So there are a lot of win-wins if we as a clinician team get together and say that if impending climate, extreme weather, heat, all these problems, it's best that we continue to reimburse telehealth at the level that it is.
Yeah, really interesting.
What we collect. So there are a lot of opportunities rather than more work. It might be opportunities to improve our system, and universal health care, which it will be paramount as our population undergoes all this stress from the climate.
Absolutely. So I'll pose this question directly. Have any of the three of you ever considered running for public office? That was a question in the chat.
Doctors, no. The data shows working from within is probably the best way to effect change. So for doctors who do tend to run in politics, maybe it will help. For me, no. I really believe in the power of the community. And so I feel it's more effective if you work on mobilizing your community, because politicians do what the voters say. Despite what anyone says, that's what happens. So the voters have got to be very vocal in what it is they want. Every Republican.
So community mobilizing.
Community, and you get the power of the vote.
Excellent. Dr. Ryan, Dr. Liang, have you ever thought about it? What's your thought on public office?
I have thought about it, and I decided I do a lot better from the educational standpoint and influencing the future that way. And for people who like doing things like being in public office, hopefully I can get the message in early in their career.
Excellent. Dr. Liang?
Yeah, I totally also act kind of with both our panelists at this point. For me, I also want to kind of focus on education. Secondly, is that the engagement as a citizen. So that's how I want to kind of, pursue along the line of those kind of, the work. There's one question I tapped the response and disappear. Probably I can repeat it here. Is any kind of future financial cost associated with the climate change in Florida, and also any I would say that I want to respond to those probably Florida Department of Health and also BRACE, the program. Currently, I think it's hosted by the FSU, Florida State University. I think those are the two places you can get most of the information you need for state of Florida.
Excellent. Thanks for sharing that, Song. Yeah, I'm new to this whole Q&A thing, so that once you answered it, it disappeared for me. So thank you for that. And let's see, what is a manufactured home? Can you explain that, Dr. Holder? I think you referenced the term.
Yeah, that's the better way than calling them trailer homes. We
Yes.
prefer manufactured homes. There's such stigmatization with trailer parks, so we avoid stigma at all costs.
Excellent. I like that approach. Do you have any uplifting remarks about the future?
Oh, can I ask a question of Dr. Song?
Absolutely.
What do you think is the next emerging pathogen based on some of your data that we have to, because that's would be interesting for us, for me as a clinician.
I want to say that I'm going to disappoint you. I won't have any answer for that. But the one thing I do want to say, I want to kind of share with you are sort of our very small kind of, like this editorial from the Lancet, and publishing editorial from Lancet publishing, I think in early January. And it's talk about the both climate and the COVID-19 converging the crisis. I think it's probably something, we can gain from that, the editorial, is that what it says is that the both crises share some commonalities and their effects are converging. The climate emergency and the COVID-19 are zoonotic disease, are both born of human activity that has led to environmental degradation. Neither the climate emergency nor a zoonotic pandemic were unexpected. And both have led to preventable loss of life through action that are delayed, insufficient, or mistaken. So I would say that's one of those very good points that I think it's something we don't know what's exactly happened, but it's unexpected.
Let me ask, I'm going to share one more question. It's a fantastic song. And I love that, the parallel, because we tend to think of them as comparable, but to think about them having the same anthropogenic roots. It's our treatment of the earth, our delay of response, really well articulated. I want to do one more audience question that's come in. So in regards to the public policy side, do you think that we need more public officials who are educated in the science to make it easier to diagnose and solve the problem? So do we need more public officials educated in science? So scientists in the public office, I think is the sense of the question.
If the scientists in the public office will respect the science, because I know our public health department has some very good people. However, some of the decisions that were made did not have equity and have been overrun. And we've had the history, everybody saw what happened with coronavirus. So before I would say absolutely, until coronavirus happened and I saw total disregard of the science, like the decision to just now forget about masks in Mississippi and Alabama, that's not the science, that's not what's recommended. And so I'm sure they have a lot of well-educated people saying that's really not what should be done. So I think it's beyond having educated people who are running the policies. I think it's having a majority of folks who will respect the science and use it appropriately, whether you're MD, PhD, or just a regular citizen scientist that happen to be in office. Again, that's why I push for a lot more citizen scientists. So when they get elected, they have been taught.
So I think Dr. Hoder's cutting in and out. For me, at least she is. Dr. Ryan, do you want to add anything to that?
You saw me nodding enthusiastically there. I
Mhm.
think it's less that we need people who are fully sort of on the science track to be the public officials. It's more
Mhm.
that public officials should have familiarity with the scientific process, with what research is, and that could be, sort of increasing that engagement component that Dr. Liang was talking about, or it could be simply making sure that the sort of scientific process is something that people just understand. And it's one thing to dismiss the science, it's another to acknowledge the science and not do what the science would tell you, right?
Yeah.
And I think that sort of getting the language right is a lot of it.
Yeah, excellent point. I am mindful of the clock and we are out of time. I want to thank the panelists for their contributions and to the discussion. And I want to leave you with a metaphor. I heard this yesterday. I cannot take credit for it. And I heard it from my mentor. So I don't know where she heard it, but I'll share it with you. And it is sort of a parable of a man looking out at a lake. And it's this beautiful lake. And then as he looks closely, there's a dead fish. And the fish is floating on top of the lake. And he says, what happened to that fish? What's wrong with that fish? And the next day he comes back and there are like 50 fish belly up in the lake. And he looks at that same beautiful landscape with that lake with 50 fish. And he says, what's wrong with the lake? Right? Now you got 50 fish. What's wrong with the lake? And he comes back the next day and the whole lake is belly up, right? You've got all of the fish population. And it's only at that point that he says, what's wrong with the groundwater? And I think that when we think about racism, when we think about sexism, when we think about all of the isms that exist, but when we think about inequities in health and inequities in the distribution of hazards and risks that are inevitably coming with climate change, we have to recognize that the system itself is broken, right? And it's not enough to target the outcome of every person and every poor health outcome that's coming. We really have to make systemic change and go upstream. So with that, I'll say thank you and turn it back over to Hannah.
Thank you so much. What a wonderful story to end with. Thank you all for all the panelists for joining. I definitely think there's been a lot of different pieces talking about how Florida is an example that can be used, or Florida is a interesting perspective to have on global health as well. And I just think that that's something to keep in mind and thinking about, even conversations like this, bubbling up to conversations at a statewide level, bubbling up to connections at a national level. Every person that joined this call, their networks and being informed of those. And so there's this ripple effect that comes from these kinds of conversations. It's really powerful and impactful. And I know I learned a lot tonight and hope everyone else learned a lot tonight. Thank you everyone for joining. We're gonna stop with just a couple of quick resources shared by Dr. Holder. And Dorothy, could you share your screen? Thank you. So the resource that Dr. Holder mentioned, the Florida Clinicians for Climate Action, it's a wonderful organization. I don't know if you want to say something quick about it, Dr. Holder, but we did have this resource here for you.
No, that's fine. I told everyone before, it's getting clinicians to get educated, engaged, and advocate. Those are our three big words: educate, advocate, and engage.
Wonderful. Could you go to the next slide, Dorothy? Thank you. Oh, and this is another resource that I think you might have mentioned earlier.
Yeah, we give these out. We can mail them to you. It's our heat wave, and it tells you the main health impacts and just different ways. And it's a tear off, and we have those available at FCCA.
Wonderful. And the final slide is a little bit more information about our next panel, which is going to be the last in this three-part series, Sustainability into Practice. And this is going to focus more on community resilience to climate change impacts. And that's going to be on April 1st from 6 to 7:15 p.m. as well. And we hope that all of you will join us there also. we'll be publicizing that more broadly in our networks. And finally, some social media to follow all of us on. So thank you, everyone. And I think we might, Dr.
Oh,
Jacobs.
I forgot one last thing. Can
Oh,
I,
sorry.
the TED Talk, I forgot the TED Talk. I'm supposed to always remember to TED Talk.
Definitely. And we will be following up with all the attendees with a recording and any resources that from the panelists that they want to share. So you'll have that in your emails as well. Dr. Jacobs?
Yeah, I just wanted to jump in first to thank everyone for participating. I think it was a great discussion. There are a couple of comments I just wanted to follow up on really quickly. One was about the interdisciplinarity and connecting. There was a question about, do we need more politicians who believe in science or who are trained as scientists? And the metaphor I always use is bridge building, which is to say, you're not going to build a bridge without an engineer. Obviously, the engineer can tell you how to build the bridge, what they need to build the bridge, and all of those kinds of things. But what the engineer can't tell you is if the people on either side of that bridge want the bridge, what the socioeconomic impacts of building that bridge might be, and thus whether or not the bridge should be built, which is to say that we need people who can speak across these different disciplinary boundaries, who can connect the science or the tech side to the policy side, to the humanistic side, and so on. So to use the example of Zika virus as one, the University of Florida is better equipped than perhaps any institution in the country or perhaps the world to study Zika virus. We have the folks who can study that from a pathogenic side of things, which is the people like Song, and we've got the folks in the geography, medical geography field who can map it. We've got the Center for Latin American Studies who can track it from its social and humanistic impact, and so on and so forth. So what we need are people who can speak across those boundaries and take them seriously, no matter which direction you're going across those, right? Which is to trust their expertise and what they bring to the table in those conversations. The other point I want to mention that speaks directly to that is an initiative that the Graham Center is launching actually tomorrow with a health policy leadership academy, where we're working with the Florida Department of Health on this, but it's hopefully this pilot program will expand down the line. The basic idea is, when you have new public officials, many of whom may come from very different backgrounds, say you have a real estate agent who now becomes a county commissioner, but they have a role to play in public health decisions. What do they need to know to be able to do that, right? So what are just some basic foundational things that they need to know to do that? So we're partnering with the Florida Department of Health and the College of Medicine on this new academy. It's a 12-week session every Friday. We've got 9 fellows, mostly from here in Gainesville and Alachua County, but a couple others from around the state. It's a pilot this time. We're hopeful that we'll be able to do something larger down the line. But it's speaking to this very issue of how do we begin to train public officials in this space in public health, but it's also translatable to other types of fields beyond public health too, right? So we're hopeful that we can grow out of this model into something larger still. But it speaks to some of the questions and some of the issues that were raised during this very informative and engaging panel tonight. Thank you to all of you. Thank you to all the remote participants who were listening in too.
Thank you so much, everyone. Have a great evening. Thanks for joining us.
Thank you. Bye-bye.
Bye.
Thank you all.